Hi all, this is Dr. Reshmi. In this video, we are going to see about postpartum issues. So, the postpartum period is the period following childbirth during which the body tissues, in particular the genital and the pelvic organs, return to their pre-pregnancy condition and continues till about 6 weeks from delivery. What is immediate puerperium? It is defined as the first 24 hours after the birth of the baby. In this period, the uterus contracts and thus bleeding from the placental side ceases. Latching and breastfeeding is initiated in this period. If the normal events fail to occur in the immediate postpartum period, excessive bleeding, circulatory collapse and cardiac failure can occur. So what is early puerperium? Early puerperium is the period between the 2nd to the 7th postpartum day. Puerperial changes continue to occur during this time. The new mother comes to terms with her role as primary caregiver too. Late puerperium. Late puerperium is the period after the first week until the 6th week. The woman is asked to contact the healthcare provider in case of any problems. Changes during puerperium. In uterus, after the birth of the baby, the uterus contracts and is felt abdominally. The gradual shrinking of the uterus to its non-pregnant size is called involution. The inner lining of the uterus starts shedding and the resultant vaginal discharge is called as lochia. Lochia rubra is a fresh bleeding and is seen 4 days after delivery. From 5th day to completion of 2nd week, the discharge is blood-stained or brownish yellow and it is called as lochia serosa. Changes during puerperium in the breast. The first milk produced by the breast is a yellowish and watery discharge called colostrum. It is very rich in nutritive and immunological factors and is essential for the baby. The hormone prolactin helps in milk production within the breast tissue. Oxytocin causes the milk let down from the breast tissue in response to the baby suckling. Therefore, it is important to put the baby to the breast immediately after birth. Changes during puerperium. Now, we'll see in case of perineum. Most women with vaginal delivery either have an episiotomy repair or a perineal tear repair done. Good hygiene for these wounds should be advised. Antiseptic solution can be given twice daily. Antiseptic creams for local application should be given. Hot water wash, sitz bath are equally effective. In cesarean section, abdominal wound care should be given. Avoid sexual intercourse for few weeks to allow healing of the genital organ and also to prevent infection. So now in case of bladder, the pregnancy hormones decrease the tone of the bladder. The woman must be directed to empty her bladder every 2 to 3 hours. The women must be taught postnatal, perineal and bladder exercises to improve the tone of the pelvic floor. In bowel, the patient usually complains of poor bowel movement in the immediate and early puerperium. Laxatives, high fiber diet and plenty of liquids should be advised. So what is puerperal pyrexia? A temperature of 38 degree centigrade or higher which lasts for more than 24 hours on any occasion in the first 14 days after delivery or miscarriage is called as puerperal pyrexia. Etiology. Genital tract infection is the most common one. Breast infection or mastitis, urinary tract infection, deep vein thrombosis, respiratory tract infection and other non-obstetric causes. low socioeconomic status, anemia, poor nutrition, and also sexual intercourse. So, persistent fever, pain abdomen, foul smelling lochia, and parametrial tenderness are usually seen on per-vaginal examination. The investigations commonly done are complete blood count, high vaginal or cervical swab, blood culture, urine microscopy, and also culture. Treatment is usually antibiotics, either oral or parenteral. Postpartum mood disorders. Postpartum mood disorders constitute a spectrum of clinical depression seen after the birth of the baby. The mildest form is seen in 85% and is called baby blues. The patient has a labile mood, irritable, anxious, and appears confused, has crying spells, disturbed sleep, and appetite. Baby blues peak on 3rd to 5th day after delivery and resolve 2 to 3 days later. Postpartum psychosis is a rare condition. Symptoms generally present within the first 4 weeks postpartum but can manifest up to 90 days after delivery. Postpartum psychosis with delusions and hallucinations causing the patient to hurt themselves or others. Suicide and infanticide is common. Postpartum depression is seen in 10 to 15% of the cases. It is a condition that lies between two extremes: excessive anxiety about the baby, fatigue, psychomotor agitation or retardation, sleep and appetite disturbances, difficulty in concentration, feeling of guilt about motherhood or the symptoms. It can last for about 6 months to 1 year if left untreated. Subinvolution. So, delay in the involution of the uterus is called as subinvolution. The uterus is usually felt around the level of umbilicus after delivery when it is well contracted. At the end of first postpartum week, it is felt just above the pubic symphysis. Subinvolution of the uterus usually points towards genital tract infection or retained placental bits. Lactational amenorrhea. Amenorrhea in a woman who is exclusively breastfeeding is called as lactational amenorrhea. This can vary from few months to even up to 1 year. Lactational amenorrhea occurs because exclusive breastfeeding continually suppresses the normal hormonal patterns required for ovulation. Thank you. Please like, share, and subscribe if you like this video.